646, all new for you this morning. It is a condition that affects about 1 in every 10 women in the United States. And on top of being very painful, it can cause complications when it comes to pregnancy. We are talking about endometriosis, or endo for short. March is actually a month dedicated to raising awareness for endo.
And 7 Eyewitness News reporter Jeff Slauson shows us it's a condition that many women have, and Jeff, they don't even know it.
Yeah, that's exactly right, Ed. Now, this is something that is affecting many, many women throughout the country, and something that isn't really that well known for multiple aspects, but one of the main ones is the stigma that surrounds it.
There's constant pain, so you kind of just want the pain to be done.
Since she was in high school, Sarah Bernstein knew something was wrong.
Point where it's like affecting work and my social life and everything else.
The constant pain led her to seek help, and within minutes, her doctor knew the diagnosis.
I was diagnosed at age 24. I'm 28 years old now, and I just had my 3rd surgery.
The diagnosis was endometriosis, a disorder in which tissue that normally lines the uterus grows outside, sometimes affecting the ovaries, fallopian tubes, and even intestines. This leads to intense pain and menstrual irregularities.
Much more about it that we don't know than we do.
Dr. Adam Griffin at the Buffalo IVF is at the forefront of studying and diagnosing endometriosis here in Western New York. He says that his patients don't often realize they have it.
And so a lot of women will just kind of suffer through what may be a disproportionate amount of pain on a month-to-month basis.
Looking at the numbers, endometriosis is found in 6 to 8% of all women, but that number is much higher in women who experience infertility.
Women who experience infertility, we see it in about 30 to 50%. And for women who have infertility and pelvic pain, pain that they would consider, affecting their day-to-day life when they have it with their menstrual cycle, it can affect up to 80% of those patients.
Right now, there is essentially only one way to confirm someone has endometriosis.
No blood test, no imaging study, no biopsy, no way we can really identify the disease outside of doing diagnostic surgery.
All too often, women don't even get to the surgical table because they are told by many that their pain is something everyone deals with.
Like, okay, we'll suck it up, People always say, well, it's just, this and that. It's pain, you'll deal with it, go ahead. But I think it's a different type of pain, like people don't really understand.
It's a stigma that Bernstein wants to end because not all pain is created equal. Bernstein just had her 3rd surgery for endometriosis last week. This one of the most serious.
I did unfortunately have to have one ovary removed.
But this is all in an effort for her to end the pain. And she encourages anyone out there with issues to speak up and seek help.
You're not alone. It's a very common disorder. And
keep fighting and keep advocating for yourself.
Bernstein did say that she's hoping that this 3rd surgery is her last surgery. When talking to Dr. Griffin, he said that there is some technology being workshopped right now that can help to find out if you have endometriosis without the surgery, but it's still a far way away.
What's interesting, what she said is that most women don't even make it to the surgery table, but she's had 3 so far. So what makes her case different?
It's the idea that she actually was able to diagnose and figure out that she had it, and then as soon as she realized that she had endometriosis, that 1st surgery diagnosed it, and then from there on out they're able to more accurately be able to tell what they need to do.
It's that self-advocacy, it seems, that's most important.
And right now, such an invasive way to have to get that diagnosis, to have to get surgery.
Right, it's as we showed with the statistics, so many women deal with it, so it's just the idea that it takes a little bit of a push and to realize that your pain isn't what everybody else is experiencing.
Those signs and symptoms all available for you right now on WKBW.com. Really eye-opening, Jeff. Thank you so much.
All right.